feel free to use the reactions and put for your hand up or clap or anything else that you like to do during the session. So if we can hand over to you, Catherine, I'll
Thanks,
mute
Dave.
everyone as we go along. Thank you.
Lovely, thank you. I've put together a little PowerPoint so that just so that you've not got to just look at me waffling on. I just thought sometimes a bit of a visual is nice, so I'll just bring that up now. And then if you can just let me know whether you can see that, because I can see you guys. You can just give me a thumbs up if that's appeared, and then I'll just put it on the proper presentation. If it's going to let me, is it from the beginning? Has that gone? I was in a meeting the other day and it didn't seem to go large. Has that gone large on everybody's screen now? Yeah, super, thank you. Okay, so I'm Catherine Briars and I'm the project manager for NCT's Parents in Mind. NCT stands for the National Childbirth Trust. So NCT is a national charity supporting parents during the first 1,000 days is a famous phrase that keeps kind of getting circulated around a lot at the moment. And that means basically from when a pregnancy begins until baby becomes 2 years of age. It's sort of roughly that time period from conception to 2. So that's the window within which NCT work. And the charity's been around for 60 something years, and so they're kind of really well established in supporting new parents in beginning their parenting journey. And they had a long history of having delivered effective peer support, mainly around antenatal classes when mums are pregnant, and also around breastfeeding and peer support around breastfeeding. But it was identified in 2015 that there was very little NCT were doing around mental health. So they put in a bid to the Department of Health to secure some funding to run Parents in Mind. So it was taking the learning that was available within NCT around what worked as effective peer support within this transition period for parents, historically through breastfeeding and through antenatal support, and then looking at working with the Institute of Health visiting to sort of understand different challenges and mental health challenges in that period, and seeing if there was a space for this kind of support nationally. So 3 sites were selected, and I was put in post in January 2017 to run the Halton Parents in Mind service. So it started out really small, and we ran for the Department of Health funding gave us sort of 18 months to kind of get the project running, and then from that point we were commissioned by Halton CCG to continue the work. I'm a St Helens resident, and I knew that there was a gap in St Helens as well, so I approached the commissioners there, and it's also now funded in St Helens, and we've just received a small pot of money for a development of the service in Halton to basically be able to sustain the remote offer that we've had in COVID. As we go back to face-to-face, we wanted to keep that remote offer available to parents who were unable to attend the face-to-face support that we were originally delivering before COVID. And we've also received some money to run a skeletal service in Warrington, just to pilot it there, and that was all through the BCA. So we're really excited to kind of be able to branch out a little bit further. So it's so distracting that I'm looking at the slide and I can't actually see anybody's face, so I just want to click back to you just to make sure they've not all left and it's not just me talking to myself. You're still there, so I'll carry on. Okay, so as the slide says, Parents in Mind, running in Halton and St Helens, just what I've explained there, and that we're in Warrington as well, and we're providing perinatal mental health peer support to local mums, and in St Helens we're running a pilot for partners as well, which we'll launch in September. We're recruiting volunteers at the moment for the partner service, but that will launch in St Helens in September, and Halton are very interested in that, so we're going to see how things go with that. But perinatal, just to clarify, is it was originally identified as conception to 1 year. So when mum's pregnant and baby being up to 1. However, lots of services have broadened that definition. So lots of NHS services, Think Wellbeing, and all, they've broadened their sort of their criteria around what perinatal is up to 2 years now, baby up to 2. So we mirror that as well. So perinatal that perinatal period means obviously surrounding the birth, if you split the word in half, and that's pregnancy and up to baby being 2. We train local mums and dads and co-parents to provide sensitive peer support in one-to-one and group settings. I'll talk a lot more in detail about this as we go on, but the support is talk-based. It's focused on reducing stigma around mental health issues and allowing parents to say, actually, I love my baby to pieces and I'm absolutely sick of the sight of them at the same time. And that's allowed, you know, as long as your baby is safe and well cared for, you're still a whole person. And I think there's an awful lot of guilt and a lot of stigma around saying, I'm finding this really hard and I don't spring you out of bed and it's not amazingly enjoyable every day. It's not, you know, a walk to a sunny meadow. Actually, it's really hard work being a parent, and opening up a space where families can talk about that, it can really lift the weight off them. So that's what we're about, really, is reducing stigma around mental health issues at this time, normalising difficult parenting experiences, and then helping to build confidence and social connections by introducing families to our peer support workers, and then obviously to other families through the group support that we offer. So attending allows clients to see the value in and be encouraged to prioritise. We're really keen to talk about their own well-being, so that, you know, there's lots of services around baby at this time for families, but it's actually making sure that as much as you're a mum, as much as you're a dad, as much as you're, you know, mum's partner, and you've got as much as your nana, and you've got this active role in helping to raise this child, you also still have that identity that's still you. You're still a person in your own right, and sometimes that can feel lost, and people can kind of really lose their identity and a sense of well-being during that period. So the volunteers themselves got lived experience of having had difficulties during this same perinatal period themselves, or they've closely supported somebody. Perhaps it might be somebody in their family or a close friend who has had those struggles themselves. They do 24 hours of OCN, so that's Open College Network accredited face-to-face training. So that, what that means in old money, because when it was said to me, I thought, what even is that? It's basically half an A level, so it's a little bit more than a GCSE, but not quite an A level. So it's like the equivalent of a year's A level study. They receive safeguarding, data protection training, and obviously we DBS check them as well. We've been working with families and children, and they get regular reflective and clinical support. But obviously, I'm not the clinician. I mobilise the projects on the ground, and I take the referrals, and we match those up with the support that we've and the volunteers and the groups and things like that. But I'm not a clinician, and obviously we're asking people to come forward and share their own experiences of difficulties that they've had historically, and to shoulder the burden perhaps of somebody else's difficulties. So we make sure that we've got a clinical psychotherapist that's attached to the project, so we've always got that safety kind of net in place that are offering the time to the project. We offer one-to-one and we offer group support for the women, and as I said, the partner service is in its infancy, and that support is at the moment out in the parks, but we've worked in children's centres before. We're going to be moving to the Low House in St Helens is going to be a birthing centre, so we're looking at perhaps, you know, working within medical environments as well. We don't want to medicalise the service, but in terms of referrals, it can sometimes ease anxiety if you go into somewhere familiar that you've been to before. And we offer local and national signposting that's obviously relevant to the family and in conversation that we're having with them. And the volunteers will also liaise with myself, and there's another member of staff called Holly, our local PIM staff, we can then go on and coordinate additional referrals that can run in parallel to support from parents in mind, or they might just be more suitable referrals at the time if they've been referred to us and we're not quite in the right place at that time. You know, we can always leave our door open and we can coordinate other referrals for the family as well. So our service users are referred by a healthcare professional. They can self-refer. We do ask our healthcare professionals, if you do feel that the person is suffering with anxiety, that little bit of hand-holding, even if it's just ringing me and saying, this lady, I've spoken to her about the service, she's really interested in support, and then we will pick up from there, and we're happy to do what, you know, get in touch and things in place. It doesn't need to be an onerous process. We do have a referral form, but we're more interested in making sure people don't fall through the net, and whatever is easiest with, you know, with professionals who have got large caseloads, you know, sometimes it's another job that goes on the pile completing a referral form. So we're always keen to make sure that pathway is really easy and accessible. But again, if people feel confident self-refer, then they can just give me a ring or drop it text, and we can send the information over for them to have a look at. So they're pregnant, or they've got a child under 2, or they're supporting someone who's pregnant with or with a child under 2. They have a wide range of mental health difficulties and needs, but they're experiencing mild to moderate compromise to well-being due to the birth of a baby. So lots of our service users have got, perhaps long-standing difficulties with mental health, some quite significant struggles with mental health in the past. But at the time that they're coming along to the service, perhaps those more long-standing or more significant difficulties are being well managed, that they are long-standing, that they've got their support networks, that they've got things in place around that, and they're actually presented as a mild to moderate level of difficulty at that time. Because of the nature of the training our volunteers have got, we do need to work in that mild to moderate area, because that's where they are best trained, and we're not best equipped, obviously, to manage cases that are moderate to severe need. But we've got all of the referrals and signposting and relationships in place. If we felt that somebody came to us and it wasn't quite the right referral, we can put in place more intensive care or more clinical care. And obviously, if somebody was to deteriorate during the time that they're accessing the service, then we're also able to engage those relationships and get the support that they need that's right for that time. All of our service users are keen to participate. So, when the service was in its pilot period and we were trying out lots of different things, we had a few service users who were sort of part of the social care plan were asked to come along, and it just doesn't work in that dynamic. It needs to be, because it's such a sharing and a talk-based support. It does need to be somebody that's wanting to come along and that's happy to participate rather than being asked to come along. Those supported by social services at level 3 or level 4, or parents who are aged 16 to 17, we wouldn't say we wouldn't work with those families, but we need to understand sort of their situation through the referral process, and we would assess where we can add value to that situation on a case-by-case basis, just so that we know that our volunteer is well equipped value and support, and that actually that family are not coming along to something that's not getting lost, dependent on the complexity of the other services and the other interventions in place. The type, frequency and duration of peer support is flexible, and as I said, through COVID, we've obviously mobilised a remote support, which we never had before. So that's through WhatsApp, it's through phone support, and we do some Zoom sessions as well. And if you can see now, it's obviously transitioning back to face-to-face, is having the capacity of volunteers to continue to provide sort of like both sides of that coin. So we've accessed some funding from Holton BCA, who are going to be able to, that's going to allow us to train another cohort of volunteers, and also to be able to staff from a safeguarding point of view those remote spaces. So we'll have both offers available, face-to-face and remote, going forward. So some positives do come out of COVID, and the service users will be signposted to other services alongside PIM where that's beneficial to them. Again, we're not affiliated to any other service, we are a charity, we are independent, but it's just if we hear someone talking about something and we've got some insight into something that might be beneficial, then we can signpost the service user on that, or make the formal referral if needed. So peer support itself is that side-by-side offer. So I'm sorry if I'm teaching anyone to suck eggs, and I've got lots of people from lots of different backgrounds here, and you may well know a lot about peer support, but I think sometimes people potentially sort of interpret it as counselling, and it's very different. It's not kind of the volunteer themselves and the peer supporter invests something of their experience into that dialogue, and the service users coming along to have that validation, and for it to kind of be that two-way conversation. And a lot of our training is around boundaries and suitable boundaries, so that what is being shared by the peer supporter is useful and relevant to the service user, and about the peer supporter. And it's kind of a tricky balance, really, isn't it? And it's making that interaction remain friendly and informal and comfortable, but also informative and validating and normalising as well for the parent that's accessing that support. So in that early postnatal period, it's such a sensitive time for mental health, I think, for parents, because if things are not going well at work and you feel down about it, or if you have an argument with another adult or whatever, that all obviously has an impact on your mental health and makes you feel more low in your spirits. But actually, when it's your child and it's potentially, it's a new baby and very much maybe look forward to or wish for or planned, or potentially gone through lots of, you know, thought to have this baby. There can be a lot of expectation riding on how things are going to be once that baby appears. And I think it's just such a uniquely difficult time, I think, for mental health, because more than any time in your life, you really kind of, it's your child, and to feel like this isn't working, or I'm not enjoying it, or it's not what I thought. There's a phrase that's going around called, it feels like you're uniquely failing. It's almost like it feels so hard to admit that this is hard, because I think social media and lots of other things lead us to believe that, you know, we're all, you know, people who want to be parents, it's in you, it's natural, it comes out, you go through the motions and that's it, and you just do it. And when it feels like you have to consciously think about it, or it's not as enjoyable as you imagined after the build up, or you've got family members who are full of advice about, you want to be doing this, and why are you still giving them a dummy, and there's all these layers of different cultures, traditions, you know, outside of the parent that are coming in, but within them as well. You know, there's all of that dialogue that's kind of fizzing around about what is a good parent kind of thing. And I think it's, if it doesn't feel natural, if it doesn't feel innate, if it doesn't feel easy, there's a real stigma around being able to talk about that, because it kind of matters so much, because this is your child. You know, it's not like a job that you can think, oh, not enjoying work, I'm going to look for something else. It's your baby. And I just think that phrase of uniquely failing, I think it's a really interesting one, because it feels so hard to share that it is a real key transition time for parents. So, you know, it's peer support at this time in terms of looking after mental health for the family, I think is really, really important. Shared experiences and backgrounds foster a non-judgmental environment. So families who potentially have worked in clinical services, or you know they've got a health visitor, or they've got a midwife, or they've got, you know, a counsellor or a therapist, the part that peer support brings to the table is that side-by-side sense of, you know, we're always keen to say, you know, we're not clinical, we're mums ourselves, we feel that this is a service that would have helped us being able to offload, empty your head, and have that side-by-side conversation. And perhaps families who have had a lot of interaction with services, it can feel, you know, it can feel quite a daunting time. And I think the idea of this feeling really informal, and the fact that the conversation is two-way, it can really kind of break down barriers for some people in feeling comfortable in sharing in this environment in a way that perhaps they might not, when they perceive it to be sort of a more authoritative figure, if you like. So that leads to the next point, really. It kind of disrupts that normal service user and provider dynamic, because it is a side-by-side approach to peer support. And we're here to normalise parenting challenges and the emotional difficulties that come with being a parent. The impact of parenting mind, I've just put a little asterisk on there, because this is hot off the press. In light of this meeting, I was just working out all these averages yesterday, because I had a report to write, and I thought, oh, I can put that in the meeting, because I'm sick of saying these details are a year old or whatever, and pre-COVID, and I thought I need to get my act together and actually make them relevant. And they are relevant, because as you can see under the picture, they were based on the Halton and St Helens combined averages for the last quarter. So the data from Christmas, just after Christmas, till the start of April, that's what's reflected here. So we take assessments from our service users when they come into the service. We have a look at their sort of mental health, and we use a document called a HADS, which is a hospital anxiety and depression scoring document. Even though it's got the word hospital in it, it's one of the only mental health assessments that you're allowed to do if you're not a clinician. So that's the one, obviously, because I'm not clinical, that's what we use. So as you can see at the top, in terms of service user satisfaction, I'm not going to read to you there, but the outcomes are really, really good. And I think certainly, as I've said, these are within a COVID time, so these are in this last quarter. And January was a really hard time to support, because I think people were just not ready, or you know, not expecting in some ways that third lockdown. And also everyone's just so jaded with remote support and just the whole thing, and it being January, which is a really tough time for everybody anyway. I'm really pleased with the data we've got there, and that is reflective of what we get most quarters, what the sort of that comes back from our service users. And then beneath that, as I said before, we take this assessment, this baseline assessment, that's the first bullet point in the second section. And averagely, when our service users come in, as you can see there, those numbers are out of 21. So they get a score out of 21, and the higher the score is, it would suggest that they have a greater need. We don't have a cut-off point. It's not like if you score a certain amount, then Parents in Mind won't work with you. It just simply gives us an idea of how that person is interpreting their well-being at the time when they access and they enter the service. A score of over 7 out of 21 would suggest that they need some support, some intervention. So our service users averagely come in scoring 14 out of 21, and for the depression score it's 11.6 out of 21. That's average. We obviously have people much higher, we have people that are lower than that, but that's an average coming in as they start to access support. That middle one is sort of any reviews they're having whilst the support is ongoing. So that might be the first review we would ever give is at sort of 7 or 8 weeks, and that drops averagely on the second review to 10.9 and 7.8 for depression. And normally when a service user is ready to leave us, that anxiety score dropped to 8.5 and depression to 5.8. So if you're just bearing in mind that 7 is the point of sort of need and intervention, then those exit scores are really quite pleasing to think actually we're there or thereabouts on where everybody is on any given day. You can kind of fluctuate, and we're sort of there or thereabouts. And having a young baby, I would say that your well-being scores might always be a bit compromised when you're not getting any sleep and you're navigating the stresses of new parenthood anyway. So we're really delighted with those, and hopefully that will continue into the future, and that will keep the service where it needs to be. So just a little slide here, really, as an overview of sort of how we fit in locally. So a part of our service is obviously the talking, and the other part is the signposting and the providing information for what's available locally and nationally to our parents. So we've managed to foster really good relationships with clinical services, so midwifery and health visiting specialist perinatal service, who, as I said before, work with moderate to severe cases of difficulty with mental health in this period, and also all the community services we've run, for a long period through Halton's children's centres, and we're part of the Halton Health and Early Years network, and we have lots of liaison with other community providers and services across Halton, and it's just I think we're really lucky in Halton that there is such a really fertile land, really, and enthusiasm across lots of professional and community organisations, clinical and community organisations, that there's such an appetite to provide good mental health support. And I know Nikki's here today from the hubs, and there's just a really fantastic focus and emphasis, I think, in Halton around mental health, and it's a joy to be part of that, and it's a joy to know that there's other professionals where you can sort of, I can't do that for you, but I know somebody that can perhaps help. And it's just lovely having those networks available to be able to make sure that even if we're not the right place, that we're connecting that family with the right place. So as I've said, we're keen to work with our partners, and whether that and give almost like a two-pronged attack really on difficulties in this period, whether that's through clinical and community services at the same time, or whether that's kind of a follow-on and an exit from perhaps the clinical service. We have lots of service users who finish with Think Wellbeing and will come into our service, or finish with the specialist perinatal service and will be referred into Parents in Mind to be part of their ongoing journey with their mental health. Just seeing if there's anything else, and I think I've covered that in what I've just explained there. So there's just a little case study here. I think sometimes hearing numbers and stuff, it all gets a bit, it's numbers, but this is a service for people, and I think there's nothing more sort of enlightening really about what a service is than seeing a quote from somebody that's used the service. So I know it's a bit long, but I think I'll read it aloud, especially because we're recording it and I don't know how easy it is to read. So this service user said, I found Parents in Mind when I was at my lowest. I was isolated, struggling with the pressures of having a newborn and battling anxiety and depression. Through the amazing work of the peer supporters and Catherine's regular contact, I was able to build my confidence to move from one-to-one support and join a group. I've made great friends with other service users, and I feel I was given a lifeline. It was my safe place, a non-judgmental haven that I could escape to once a week, where there was a hot drink and an empathetic ear. It may not sound like much, but when you feel that you can't summon the energy to leave the house, it was a beacon of light to focus on each week. Time and lots of help from the lovely ladies, but I got back on track, got back into work, and genuinely felt like a different person. I have experience of how it feels to be alone and struggling. Parents in Mind team empowered me to feel like I could cope, that I wasn't alone and that I mattered. I'm training to be a volunteer now. I want to give something back, even if all I can do is help another mum feel that she is not alone, because as wondrous as having a new baby can be, it can also be really tough. And the scores are up at the top there of where that lady came in. And as we've seen on the previous slide, 7 is the point at which we would say intervention required. So she was obviously very anxious at 17 coming into the service. And by the time she'd had that first review, she'd dropped from 11 and 9, which is really positive. And that lady has now been volunteering with us since just before COVID started, and she's really enjoying her volunteer role, and has actually then gone on into, she's still a volunteer for us, but has gone on into paid employment and is a paid perinatal mental health peer supporter for the specialist perinatal service who are based at Hollins Park and look after the Holton and St Helens, Knowsley and Warrington area. So it's nice to think that actually this training, when people are able to access it, it can then go on and be a change of career path for them, and can be part of their ongoing journey, and having given their time to us and to the mums that they support, it's lovely when there's side of it for them as well. So I've just put an overview there on the last slide of if you had got a referral or a family in mind, and we've got an email address there for referrals, parentsinmind.nw. The NW is just for Northwest, and if you wanted to ask any questions, as I say, you can just email that, you know, and let us know the family's name, and we'll get in touch with them, provided the family's consenting to us getting in touch. And as I said before, we do have a formal referral form if that would be beneficial. I know some people for audit trails and things like to complete the referral form, which is great as well. And then my contact details are on there, my email address, and I say I'm looking after the whole project, and Holly, who's our local support coordinator, she's now taking all the referrals, and then my line manager Helen Lloyd is on there as well, and she looks after all of NCT's programs in case you wanted any more information about anything else that NCT is up to, and the website's on there too. So I'll stop screen sharing now. It's so distracting when you can't see the people you're talking to, isn't it? I know we're all getting used to all of this still, though. We should be used to it by now, shouldn't we? But it's just not nice not looking at your faces. There we go. Stop share. You're back. I hope that was okay, everybody. I do waffle on. I get all excited about what we do, and I'm really proud to be part of it. And you know, I've got a long-standing relationship with Holton Health Watch, who did a lot of hand-holding for me and pointing me in the right direction when I first came into post. And I'm just really pleased at the opportunity to talk to you all, and just to, like I said before, it's just such a lovely part of the world to be in, because I have colleagues who are based in the Midlands and down south running Parents in Mind. And opportunities like this, they just don't get them, because I don't think the communication's there. And I think we're really lucky in Holton that there is such a lovely group of people who are really keen to find the best outcomes for our local people, really. And it just makes all the difference, doesn't it, to all of us really knowing that we can signpost to each other.
Okay, thank you, Catherine. I can see a hand shot up from Anne straight away, waiting to ask a question. So we'll start off in the top left-hand corner.
I just wanted to say that I think it's a really, really important thing, because as you say, you do feel that it's natural, and then you think that there's something wrong with you because you're not finding it natural. My daughter's got a 7-week-old baby today.
Oh, bless her.
Doing really well, but you never know what's going on behind. So, as in Holton Haven, what I was thinking, listening to you, is if you wanted to do any small groups or anything, we've actually got a little garden cafe and the big shed and some lovely woodland as well. So if you wanted to set up anything up here, just get in touch with me and we'll see what we can sort out.
That'd be brilliant, Anne, because I remember when I came up for a walk around with you and you gave me the tour, and I was very impressed with the cafe. Very impressed. It was fantastic. And I think as we're sort of getting tentatively out of lockdown now, it would be a really nice venue, I think, for us to be able to kind of, because I think what we're enjoying as well is with the park walks, it's opened up the opportunity that mums have then kind of stayed on and gone for a walk themselves. But actually, if we were able to come over to the Haven, they could stay on and have some lunch, couldn't they? And it just encourages them to keep building those networks and communicating and you know, making those connections with other families as well outside of the peer support. It's nice to kind of promote that independence, isn't it?
Well, I'm hoping that we will be open on the 17th of May. So if anybody wants to book us.
Brilliant.
Thank you.
We're in terms of COVID related side of things, I'm just taking instruction from NCT in terms of when we're allowed back in and what we're allowed to do. My suspicion is because of working with pregnant women and them not being vaccinated and things like that, they're slightly more vulnerable. And my expectation, obviously it depends what happens in June, and all this idea of there's not going to be any restrictions just feels a world away to me at the moment, the idea of that. But who knows what's around the corner. My perception is we will probably be going back indoors. I think when I say back indoors, the volunteers have really enjoyed the park walk, so we want to keep them as part of the offer. But I think we'll be back indoors from September. I don't think, because I think as well, when we trudged around from September to March in the rain, the volunteers were like, oh, let us go out in the sun as well. Don't send us back in now, the sun's come out. It just seems to be the wrong time to go back inside. But certainly from September on, I will be looking at venues and things. We were using Brookdale Children's Centre, but the cafe has gone from there as well, and I'm not sure we can offer a drink anymore, and that's a big pull for our mums. I know it sounds like something small, but actually when somebody else makes you a cup of tea, you feel like, you know, all your Christmases have come at once, don't you? When you get a hot cup of tea off somebody else, it just feels like that bit of self-care is there, doesn't it? So I certainly would be looking for somewhere where we could offer that, so I will be in touch, and that's fab. Thank you. I can see,
okay, Catherine.
Sorry, I've just seen in the chat. So she's put the what kind of age spread is there amongst referrals? We have mums who are working with Family Nurse Partnership, so our young mums. So Family Nurse Partnership work with mums who are between 16 and 20. So we do have some referrals for mums in that category, but then we have mums, our sort of older mums, if you like. We've got such a mixture in terms of referrals. So like I say, anyone from, I'm not quite sure, anyone from potentially 16. I said before in the referral criteria, we do look more closely case by case at 16 to 17 because those mums are not classed as an adult. So we do need some sort of heightened communication from a safeguarding perspective with a clinical professional around them. But anything from 16 to when people want to have babies too.
Any other questions? I think we've got a couple, but has anybody else? Jude's got a hand up.
Hi, Catherine. It's lovely to see you. I never get to bump into you now. I just wanted to ask, is there a waiting list for your service?
No, not particularly. Normally, when somebody's referred in, if I got a text today, we'd send them some information. So in the first instance, we send out a little video of me waffling on about what the service is and explaining that we're not clinical and we're all mums. And so I'll send that out to them to have a watch, and so they can see what types of support with the WhatsApp walks, one-to-ones, what's available. And then when they come back to me on that, we would normally speak with them sort of later that week or earlier the week after, and then they'd be out on a walk. So not really, no, there's not much turnaround. We're really well staffed with volunteers at the moment. Across, just off the top of my head, I think across, because some of our volunteers work off the time in Halton and in St Helens, but in total, I think we've got like just short of 40 volunteers now, so it's a lot of
Yeah.
And our remote support, our WhatsApp support, that's those evening groups are staffed by 3 volunteers, because we have like a phone call capacity there where if we can see someone struggling on the phone, we can jump off one of them and give them a bell and stuff. So there, it's not like we're thinly spread, we've got good numbers and it's kind of quite robust. But yeah, referrals are quite quick.
Brilliant, brilliant. And have you seen referrals go up during the pandemic with people being more isolated and things?
They dropped off a lot at the beginning and I would shout in saying, we're still here, you know, send to us, please. But I think everyone was readjusting, weren't they, to home working and understanding what was available, even though it was remote. I don't think that the remote offer, when it was all there was, it was like, right, I'll have that. But now I think people have really appreciated it. We all have the benefit of what face-to-face brings, but at the same time for us, it's also allowed us to offer support and access parents and provide to people who wouldn't have been able to come when our core offer and our core business is being done. But I think it dropped off initially and it kind of has steadily climbed. And to be honest, since sort of February, I think it's really, and we were worrying, thinking the multi people that are out there that would normally be going to baby groups and all the things that reacted to the new parent. And I was really concerned as to, like I say, referrals weren't low, but I expected them to go through the roof, and they kind of just maintained where they were. And I think it's only sort of since Christmas, I think things have really, really taken off. So
yeah. Oh, thank you. That's great.
Yeah, question from me, Catherine. Just we've been doing a piece of work on maternity services for Halton, and we're just working on the report now. I think we had 132 ladies take part in it, and looking in that, I think the comments that were coming over where we haven't been able to get out, we haven't been able to show off our baby, we haven't been able to, do a lot of things. So are you expecting the numbers to increase over the next few months? Because what we're picking up in there is that there's most probably frustration as well, and loneliness. And I'll speak to you maybe outside the meeting about something we might be able to work on with you. But we have noticed a lot of the comments were about feeling isolated, unable to, no checks on babies, not getting weighed on time, not seeing the services straight after born. And I think there most probably will be a knock-on effect for quite a while, won't there?
Definitely. And it's one of those where we've had referrals obviously across COVID, and people have said, I just don't want, I'm all zoomed out, I don't want, and so for some people it's been, it's kind of like, well, it's better than nothing. For some people it's been a really good fit actually for them. One of my worries is, we have a number of mums who have always had social anxiety at the idea of coming out, and obviously completely understandably that's going to be enormously exacerbated now by the amount of time we've all spent in the home. And so one of the pieces of work we're doing is trying to encourage those people who have become quite housebound, really, for obvious reasons, that and the health anxiety, around the idea of bringing your baby out, after being told for months and months, do not go out and wear a mask. It's quite daunting, if you're struggling with your mental health, to say, oh no, it's fine now. It's like, well, but it absolutely was not fine, and now it's fine. It's like, oh, you're all right now, you can come out. And we're doing a lot of work trying to encourage mums out into the physical spaces. Again, those that, as I say, we're not clinical, so we're working with services if there is a diagnosis there around potential OCD or a specific health anxiety. But it's just really difficult to kind of pull those people back into what we had before in some ways, because they've got used to being at home, and there is a lot of anxiety now about that being a safe place to be, which again is why the outdoor spaces have been well received, because again the government messaging has recently changed, hasn't it, around being outdoors and the fresh air and things like that. And that's actually, sounds daft, but as that message went out from the government where they did pan space, but then there's a picture underneath now, isn't it, that says fresh air as well. Yeah. And when that message went out, we actually got a greater uptake on the walks, and nothing we'd done, just the messaging had changed. And I think, it's your baby at the end of the day, and after everything we've seen and heard in the last 12 months, you don't want to put yourself or your child at risk. But then the knock-on effects on your mental health of that isolation, as you were saying, Dave, is quite debilitating, and it's that balance, isn't it? People balancing the physical health with the mental health. So I would hope that over the coming months, people will start to feel more secure in being out and about. And as I said, our remote offer has been facilitated through BCA funding. So we'll be able to continue to offer that to families that are not ready to come out and about yet. So they have got some.
Yeah, that's good. I mean, in the people who took part in the survey, I think we had over, we asked if he'd like to give us more information, and I think we had over 60 of them said yes, which surprised us. Normally you just get 2 or 3 say yeah, but I think, as Louise said to me, one mum said it's really cathartic being able to talk about my baby and what's happened. I can see a hand popped up from Irene. Pardon me, excuse me. Irene, feel free to ask away.
Yeah, Catherine, one of the issues that got raised with me during the maternity survey by a mum was she only had the one child, and she was saying that she got really distressed when she was telling me that she's concerned about her own child's socialisation and mixing with other children. And she said because they've been so socially isolated, She said, even if a stranger knocks on the door, her little baby starts screaming. And she said, and what's the impact that's going to have when she finally goes to nursery?
Yeah.
That's all she's ever known as a mum.
Yeah, and we've had a few families who have got those concerns, and that's one of the things they've been saying on the park walks. I want to come for me, but I want to come to my babies with other people, because the separation anxiety that potentially may cause, because mum's voice is always there, mum is always present, or dad, or whoever the primary caregiver, whoever's there all the time, to then make that departure. And for children who were at that point of being in nursery, and all those socialization skills and all that turn taking and all of that fantastic stuff that comes from being in those settings, they've not had access to that, have they? And I think through the Halton Health and Early Years network that I'm part of, I know there's an awful lot of work going on through the children's centres and through nursery providers to acknowledge and put in place additional opportunities for all those children and babies that have missed out on that. And I know there's a real sort of what's not the wrong word, enthusiasm, but commitment is the word I'm looking for, to acknowledge and bridge those gaps really of that developmental learning that's been missed. And that's, when I say developmental learning, I don't just mean your 3 or your 4-year-old. You're talking about your tiny infant who's never been held by anybody else, the anxiety for a small baby that's only known a certain touch from a certain person. It's an awful lot for that child to process and for their independence and well-being. That's quite frightening and daunting, isn't it? Just to have new people in the home, is a big step for a baby, because they're just not used to it. And like you said, that sense of crying at what's unfamiliar is something that's been echoed to us by lots of mums with tiny babies, but those with older children that act as our support as well, with the toddlers or even the school-age children, the anxiety that it's caused.
Yeah, that's exactly what you've said is what she was saying. And she really can see it, and it's making her distressed. Yeah, it really concerns her, because this baby was born in the lockdown.
And the thing is, I think what's difficult is what you want to be able to say to that person is, well, what you want to do is, but there isn't what you want to do. And that's what we find a lot when we're supporting our mums, is actually it's allowing that person to feel all of that and go, that's really upsetting me, and for that not to be minimised, not to be put to the side, not to be, well, I've got something more important to do, so I can't listen to you. That's what peer support is hearing that person and saying, gosh, that is really hard, and I can understand why you're worried about that, and it is, but you're a brilliant mum and you're mindful of all these things, and it's something that's hard right now, but because you're mindful of it, things will be put in place going forward by the childcare providers, by yourself, and then hearing that same worry from other mums, although it doesn't change the worry, it just kind of it gives you permission to be allowed all those feelings. And I think that in itself is a weight lifted, going, I'm not on my own, another mum to feeling like this, and and things, and for us to be able to say we know good things are happening through the childcare providers in Halton, and and I just think that's that normalising, is it normalising those emotions, and someone not feeling on their own in those thoughts, or not feeling that this is only happening to their child or to them as a mum. It's actually a shared experience, and as I said, that doesn't change the experience, it just gives that sense of solidarity that actually we're all in this together, and we've had that through COVID, haven't we? It doesn't change COVID, but knowing other people are living what you're living and feeling what you're feeling, it does lighten your load a little bit.
One lady told me going out for a walk in Widnes and Victoria Park with other mums and babies was a godsend to her. She did tell me during the when we were doing all the consultation with them, and say,
that's it. And I think a bit of fresh air and an opportunity to connect with people, just see, you know what it's like yourself after all this time, and you get out and about and you think, oh, you know what I mean, you're out of the 4 walls. And I think when you've got a baby, the 4 walls feel a lot tighter than they potentially do when you're there on your own, kind of thing. It feels a bit more closed in, because everywhere you go, your baby's there. And as I say, you can love them to pieces and be sick of the sight of them all at the same time. And certainly in the last 12 months, I'm sure that every mum has felt like that.
Well, thank you, Catherine.
Thanks, Irene.
Catherine, could I just ask, you mentioned dads before, so have you had much uptake during lockdown from dads?
Well, we're not. We've just been commissioned in St Helens at the moment to run this pilot dads programme, but I know Halton are interested, and it's kind of like they're taking turns. So Halton flew the flag for getting us off the ground in the women's service, and now St Helens have come on board, and now they're doing the bit with the part and stuff. And I say Halton are kind of like, well, you start it going, and we'll see how it goes. But we're just at the point of recruiting partners now. So the definition of partners, when it goes live in St Helens in September, it will be quite broad. So it's not just, it will be anyone that is basically providing care to a baby, or you know, up to 2, or a woman that's pregnant. So it might be that it might not be that they're suffering directly with their mental health, but they may be supporting, you know, mum who is suffering, or dad who is suffering, and actually they need to understand how best they can support that person. So we're just recruiting our peer supporters for that training at the moment. The pilot programme will run in St Helens. However, we're anticipating it initially being a wholly remote offer, so it will be phone support, it will be WhatsApp support, and then we may then start to build in some park walks and things, sort of Saturday morning park walks. Whereas I said that will be in the first instance directed towards St Helens residents, but anybody in the local area, if they're interested in the training in that partner role, are more than welcome to access the accredited training. It doesn't need to be a St Helens resident that's actually doing the training. So if you know anybody that will be interested in some accredited training, it starts on the 8th of May, so they need to get the skates on. But I'm just sweating about how many people I'm going to find. We've got like 6 at the moment, which is doable it's doable as a first pilot cohort. We can do it, and it's one of those things. I think this sort of programme, we used to have to really heavily promote getting our female volunteers, our mum volunteers. But actually, once the service is running, people start to hear about it, or they've got a friend who's volunteered, and then we end up with a waiting list now of volunteers who want to train, and we have to kind of interview them and whatever. Whereas we're back where we were 4 years ago now, running the partner service, because it's a case of finding people that are available on the days and times that are happy to offer the support, you know, because it's not an easy ask. You are taking on somebody else's mental health burden and being that person for them, and it's not a case of, you know, it's not always really easy to shoulder. You know, sometimes it is a bit, oh gosh, I wish I could do more, I wish it could help. Because that's why you're coming forward wanting to volunteer, because you want to make a difference. But that difference is sometimes mainly being that person who's there to listen and not judge and hear all that, and allow that person the time and space to reflect on something. When we're all busy people, take an hour out of your week. I'd love that. If someone said to me, do you want to come for an hour and just talk about your mental health every week, I'd be there with bells on, you know. And I think if you've got a young baby and you're just not getting a minute for yourself, it's so important to prioritize that window where you can just anonymously just let it go, let it out, have a chat with somebody that's not getting paid. They want to be there, they want to give you that time, you know. And that's again a different offer from perhaps a professional service. That person is setting the time aside because they want to be there for you. So
drop us some information if you're looking for people, and Jude will send it out, and we'll put it in the e-bulletin and social media and see. And if are you after, I'm going to say after men, I know your partner's wide range now, but if I might even spread it around some football teams, you never know.
That would be brilliant, Dave. I've tried going to Widnes Vikings, but I've poked them a few times, but I've not really heard anything back. I just think with it being accredited as well, and with it being on, it's probably going to be remote support. You know, it's not going to involve any travel, and post training we ask 2 hours a week, and we can be flexible around, you know, the person volunteering as to when that 2 hours is. Certainly if it's phone support, you know, it's completely, you know, between them and the service user they're supporting, you know, as and when that support is. But let's say, because it's an accredited training, you know, it's something people can have on CV that will be recognised, you know, as a legitimate, you know, qualification. And if they're looking for a career change or something to complement, you know, if they're looking towards counselling or going into anything mental health or family related, you know, it's to get something back out of the training for themselves going forward.
If you let me have the details, and also Nikki's said if you want to get men involved, let Nikki know.
Thanks, Nikki. That'd be brilliant, Dave. Thank you. Like I say, it's one of those where you either to a point, don't you? And then you think, like I say, I'm just at the point now where I've kind of got enough, but the more voices and the more people, the training is always better, isn't it? The more that you can kind of have those different perspectives from different families.
I can see Colleen with the hand up as well.
Thanks, Dave. It was just, I'm not sure, are you looking for, are you asking, offering the service to men to contact, or are you looking for male volunteers to help men who will contact you for the service?
That's a good question, Colleen. At this instance, because we've trained so many women, we're looking to train men. We've got 2 cohorts of funding for this partner programme. But the first one, because we are so woman heavy, we wanted to do a men's training. But actually, then when we go out with that offer, we've got those men, we'll have some men trained, and we can then, you know, men, we've done a lot of sort of canvassing of opinion and trying to understand, because obviously I'm a woman, so it's you know, it's no good me saying, well, this is what men want. We've had lots of conversations around potentially what men would want from that support, and it sounds like they were saying in the majority, it's nice to speak to another dad or another partner of mum or whatever, but at the same time, to be honest, I just want to be able to talk really to somebody, and they're not actually that bothered who that one-to-one person is. So we want to have that male presence in the volunteer team. So that's who we're recruiting at this interval, so that we've got that there available if that's what someone is looking for. But the actual partner offer, if you like, when that goes live in September, that will be to anyone who is supporting a young child. That might be, you know, we've got a few volunteers currently who are grandmothers who have said, I struggle myself, but it wasn't recognised when I became a mum that actually mental health can be compromised, and they are supporting their own, you know, daughter now through a pregnancy or with a young child. And you know, they know lots of different types of roles around the baby, actually not just that mum role. And so they would be part of our partner offer, because mum's closest support, mum's main partner, if you like, if she's a single mum, it might be her own mum, it might be her own auntie, it might be her own sister, and actually that's a really hard role to be in, to offer that support to someone who's struggling. So the partner offer will be broad, but at this point, because there's two sets of funding in that pot for 2 cohorts. The first one, we're just going to try and get some men involved in this training, so that we've got that male dynamic, so that then when we're working with services, we've got more breadth to offer them, so whatever they're comfortable with then.
Okay, could I just ask, is there an age limit on the men? Are you looking from?
Not at all. I mean, I think we'd say 18 plus, just so that they are sort of, from a safeguarding point of view, they're classed as an adult, but absolutely any age, you know. And we've said, you know, we've asked if there's any granddads, uncles, you know, just all different perspectives. It's just really, I think the broader the range, the better, as I say, because within our women that we've trained, we've got grandmothers, we've got young mums, you know, we've got, and they've got on famously in the training and really enjoyed talking together and about their experiences, because actually being a parent is being a parent, whether you're an 18-year-old parent or you're an 88-year-old parent. There's different worries, but still worries out there. You're still worried about your baby, no matter how old your baby is.
Okay, I'm just looking around. No other questions. We come up just on 12 o'clock. If there's nobody else wants to ask you, Catherine, I would say a very interesting presentation, and again, I've learned things. One good thing about all these sessions we've had, I come away thinking I never knew that before, or so that's really helpful. And I will catch up with you outside the meeting. I'll email you on a piece of work we're doing. Thank you all again for coming. We have another one. The next one, I was just trying to check. We have I think it's Deafness Resource Centre is the next session we have, which is actually, not in a fortnight's time, next Tuesday, same time, same place. So we look forward to seeing somebody. If you need an invite for it, email Louise, and all being well, if the recordings work properly, we'll pop this recording up on Facebook later on today and on YouTube. We're developing a YouTube channel.
Oh, how exciting!
Yeah, well, it's got 3 videos.
It's got 4 now.
Yeah, that's 4, yeah. Okay, well, thank you everyone for coming along, and hopefully we'll see some of you next week as well.
Thanks for
and
your time,
spread the word.
everybody.
Oh, you're welcome, Catherine.
Have a
Take
great
care now.
week.
Thanks.
Thank
Okay,
you.
Thank
bye-bye.
you,
Bye.
Catherine. Bye,
Bye.
everyone.